Hello guys, welcome to a new video. Thank you so much for tuning in. I am so sorry I've been MIA lately. It's been a long time since I posted my last video. A lot of crazy stuff going on in my life right now. As you can see, I cut my hair. I cut it, I got some bangs, so I feel pretty. Alright, anyways, today we're gonna talk about a subject that to me is very important because as a future nurse, I would have liked somebody to talk to me about these things before getting into nursing school, because there are several different paths to become a nurse. Every person's different and everybody's gonna have different goals, so that depends on what program suits you better, what are your needs and what are your goals. So I hope this video helps those people that are still trying to decide what nursing program they want to go in. Sorry about the sun, it's like 5 o'clock, so it's coming this way. Maybe it'll be on my face in a couple minutes, so let's get this over with quickly. So today we're going to be talking about the differences between ADN and BSN. I personally chose the BSN path, and at the end of the video I'm going to explain to you like a little bit of my experience and why I chose that path, but I'm going to explain the differences very quickly. So first thing we're going to talk about is the terminology. ADN stands for Associate Degree in Nursing and BSN stands for Bachelor of Science in Nursing. The second thing is how long does it take? Of course, it's all going to depend on if you're doing a full-time student enrollment or a part-time student. As a full-time student, of course, you're going to get your courses done quicker and you're going to be done quicker. As a part-time student, you may have less courses per semester and you're going to have more semesters, and that's going to add up maybe a year or two depending on the course load that you have every semester. But generally the ADN takes about 2 years and the BSN takes about 4 years. Usually if you have an ADN degree, you would want to pursue a RN to BSN program, which can be 1 year long or more, again depending on your school, depending on the program they have, depending on if you're part-time, full-time. There's a lot of things that are gonna influence on how long that program is gonna last for you. The third thing is gonna be the scope of practice. ADN programs focus more on technical clinical tasks and day-to-day care. Nurses that hold a BSN degree, they're able to do the same tasks, but they have an extra component that make nurses able to pursue management positions, leadership positions. So that's an extra component that some ADNs don't include, but it's going to depend on your school, it's going to depend on the program. So it's very important that before enrolling, you do your research, you talk to an advisor, talk to the school. That entirely depends on you. Now the fourth thing we're going to be talking about is the job opportunities. A lot of employers have shown that they prefer, they don't require, but they prefer nurses that hold a BSN degree, but that doesn't mean that a nurse that holds an ADN degree, it's not going to get a job. That's a complete lie. Nurses in general are in high demand. That strictly depends on management, on the hospital you want to apply to, some clinics, depending on the setting. However, it's not a requirement. So you can still apply for nursing jobs with an ADN. It just depends on the facility you're applying into. The fifth topic is the NCLEX. NCLEX stands for National Council Licensure Examination. That is a test that every nurse has to pass in order to get their registered nurse license. Both ADN and BSN are able to sit for the NCLEX. However, there's a difference. Nurses that hold a BSN degree are more likely to pass the NCLEX on the first attempt than nurses that hold an ADN degree. But that also depends on your school. So another thing that's very important that you ask your school before enrolling in a nursing program is that you ask the NCLEX pass rates for either program, BSN or ADN. Here I'm going to do a little voiceover because I forgot to mention an important point, which is number 6, the salary. Generally, a BSN pays more than an ADN 2-year nursing degree, and that's reflecting the additional education because, as I mentioned before, it also is affected by experience. What state are you in? But basically, ADN degree nurses make around $70,000 a year,
and BSN around $85,000. So as you can see, there's a difference of approximately $15,000. That's an annual salary, but again, there's a lot of things that are gonna influence on that.
Now, the seventh topic we're going to talk about is the program curriculum. ADN versus BSN. ADN programs usually emphasize in clinical skills, labs, and core nursing coursework. On the other hand, BSN programs have the same core nursing coursework, and they usually add research, management, leadership components that would allow you to pursue management positions as a nurse. Again, that's going to depend on the curriculum of the school you go to or the program you're enrolling into. The eighth topic is going to be the clinical experience. Some schools offer the RN to BSN program where there's not a clinical rotation or clinical hours, but sometimes they replace it with a community health project or something like that that replaces the clinical hours. As a new grad, you're going to see that you need experience to enter the field. Naturally, you're going to do better in your job as a nurse in an entry position or as a new grad when you have your clinical experience. You're going to be lacking all that experience that is going to affect you afterwards when you get a nursing job. Again, that depends on the school, so make sure that before you enroll in any program, you talk to your advisor and you talk to the school and see how their clinical rotations are. Oh my God, I'm sweating. So of course, there's going to be pros and cons for each program. It's going to depend on you, it's going to depend on your goals, it's going to depend on your experience, it's going to depend on what you want to do. So I'm just going to sum it all up and give you some pros and cons from my perspective. So basically for ADN programs, the pros would be you would finish a lot quicker because it's only 2 years instead of 4 compared to the BSN program. That of course translates in the second pro, which would be lower cost education because you're saving a lot of money in all of those years that you are not going to go to school. But that might translate in going to an RN to BSN program, which it's going to depend on the school how much the cost is going to be for the program, but that is something that you have to look into. Another pro would be that you would get an RN job a lot quicker. Some cons I would consider would be lower salary. Sometimes we see that BSN nurses get higher salaries than ADN nurses, but that would also depend on the state, on your previous experience. It depends on a lot of things. So don't just wrap your hand around that. You have to also consider a whole bunch of things. This is not a general universal truth. There's a lot of factors that are going to influence. Another thing would be more limited on the job responsibilities because, as I said before, you would have more day-to-day patient care, like monitoring patients, instead of like more like leadership or management positions that you could get into. But again, that is something that your program may or may not have. And another con would be that some employers, they prefer to hire nurses that have a BSN degree rather than an ADN degree. And now let's talk about some pros and cons of BSN program. So it would be pretty much the opposite of what I said before. Some pros would be higher salaries, more comprehensive nursing curriculum that has the components like research, leadership, management. Another pro would be that it's you have higher chances to pass the NCLEX on the first attempt, but again, that is not a universal truth. Sometimes there's BSN nurses that have to take the NCLEX several times, and there's ADN nurses that just had to take it once and they're done with it. So it really depends on you. It depends on the pass rate of the program you're in. So there's a lot of things that are going to influence in that. And another pro would be that it positions you best for a career advancement. Like if you want to pursue a master's degree or a doctor's degree, a lot of these programs require that you have a BSN to enroll. But again, as an ADN nurse, you can get into an RN to BSN program. So basically it will take you to BSN. BSN takes you to master's or doctorate degrees. So it's whatever's best for you. And of course, some cons would be that it takes longer, higher cost education because you have to go to school for a couple more years than if you were doing an ADN program, and delays the working experience as a nurse, of course, because it would take you longer to graduate, but you will have your experience of your clinical hours, so it all compensates. But again, That all depends on you, that depends on what your goals are. Now I'll tell you guys about my personal experience. So in my case, I decided to go for an associate's degree in arts. My school doesn't have a 4-year BSN program. They only have the first 2 years of prerequisites, and then you have to transfer to another school. So what I am doing is I'm taking my 2 years of prereqs of associates in arts, and then I'm transferring to another school for my BSN program. One of the most important things you have to do if you're going to do that, you have to check what are the prerequisites needed to enroll in the BSN program of the second school you're going to finish your BSN in, and check if the associates that you're getting in the first school for your prerequisites has all the classes and all the programs needed. So in my school, we have the ADN program and they have the RN to BSN program. The catch is that you can't go and enroll straight after you're done. You can't go and enroll in the RN to BSN program. You have to take extra classes, which is very weird because if it's in the same school, like why wouldn't you just add those courses to the ADN program and be done with it? As soon as you're done with the ADN, you have to take extra courses and then enroll in the RN to BSN. So I really don't understand why they do that. If it's the same school. So right now I'm halfway done with summer. If you haven't seen my last video, go watch it. I explain everything on why I had to take just one class this semester, but long story short, I had to take a test. I didn't pass one of the sections, so I had to enroll in one class and then retake the test. But I did retake the test and I passed it. So now I get to enroll in college level classes, which means that I get to register for classes related to my major. This semester has 12 weeks. What I did, instead of registering only 2 classes because that would cause me to fall behind, I registered 4 classes, but they're all 6 weeks. So what I did was split my semester in 2. I'm gonna have the 2 first courses for 6 weeks and then the other 2 for another 6 weeks. So my goal is to finish 4 courses this semester so I can keep up with my curriculum but also work full-time. I'm gonna go crazy. I know this. I know what you're thinking. This girl's crazy. She's crazy. I know I am crazy. But, you know, if you are, you know, very focused and you have your schedule and you organize yourself, you're gonna be able to do anything that you want. If you want, I can show you guys in the next video how I organize myself, some study tips. I don't know, you might find it interesting. But yeah, so that's basically it. If you have any questions regarding the ADN, BSN programs, just leave it in the comments. I'll be answering any questions you guys have. And now I have a lot of homework to catch up on and a lot of studying. I gotta get ready, gotta get all my A's and crush it. I really hope you enjoyed this video as much as I did. I actually enjoy doing all this research because I know there's people out there trying to figure this out, and I was one of them. So I really hope this video can help somebody that needs it. Again, please talk to your school, talk to your advisors, and get many opinions. Also talk to nurses if you know any nurses, and try to create, you know, an idea of what you want, make a pros and cons list, and I'm sure you'll do awesome. If you made it till the end, thank you so much for watching. Share it to somebody that can use these tips. If you have any questions, leave it in the comments, and don't forget to subscribe. See you soon.